Thank you very much. The Deputy Minister for Health for the Russian Federation to introduce him. Thank you very much.
Добрый день, уважаемые.
Good afternoon, esteemed colleagues. Dear friends, thank you so much to our moderator for the opportunity to say a few words of introduction, because unfortunately I will have to excuse myself very soon to attend another meeting. But without delaying the beginning of the event, I would like to thank, first and foremost, the government of Moscow for arranging this August forum. This forum is very timely, and the topic at hand, the Moscow standard of healthcare centers, and this is not a silo project, this is not an isolated project. This is an integral part of the overall federal initiative aimed at changing the attitude towards the work of healthcare centers. You know that among the objectives, we have the implementation of lean technologies within the health centers. In 2019, among our priorities, we see embracing and bringing to the necessary level of about 3,000 polyclinics or health centers in 2020. This project has to embrace about 7,000, or to be exact, 6,700 health centers. It actually will help us to change our approach to the patients. And this is not just a technical approach. The approach would be totally different, meaning that we will certainly increase the time spent by the doctor on communicating to the patient. And whereas the standby period will become shorter, several figures inherent to 2019. If we speak about certain institutions which have already implemented the project, I mean 385 projects which we managed to implement in 2019. The call centers delay time decreased 5 times. Actually, we decreased 3.7 times the waiting time for the reception in the health center. Also, the preventive checkup time also decreased, and it leads to the following. We increase the time of personal communication between the doctor and the patients, and the measurements done by the experts showed that now doctors spend 1.5 times more when talking to the patients personally. This is especially typical of the child health centers. Actually, among our priorities is the improvement of the work of the health centers which deal with the patients personally. And very often, this is that attitude, this is that communication which determines how patients and people in general treat healthcare centers. I wish you very fruitful work. I'd like to extend my gratitude to the government of Moscow, and I wish you stay healthy.
May I invite the speakers to join the podium, please, and then I will introduce them individually. Please, if you just come forward. Sorry, sure, of course. Thank you very much. Before we get started with the discussion, my name is Dr. Oliver Bernard. I'm a partner at Strategy in PricewaterhouseCoopers. I've spent the last 30 years of my life advising governments of various places on healthcare transformations of different sizes. Before I give the questions to our panel members, I'd like to just share a few thoughts with you. First of all, I have to congratulate the city of Moscow for having made significant progress in the last several years in the development and improvement of the medical care provision, especially also in the polyclinics and the health centers as they are. And Ms. Rakova will give us more details about this program, of course. The access to care has significantly improved. The waiting times have come down. The service is much more patient-centric. And one measure of improvements of these services is how many hospital beds are required. And despite the significant growth of the population of Moscow, the number of required hospital beds has come down quite significantly. If you can flash up the first slide, please. Next one. Next one, please. So just very roughly, so you see the population increasing significantly, hospital beds going down, and you see that is an international trend of reducing hospital beds to make them more efficient. All of us would much rather recover from illness at home rather than a hospital bed, and easing access to care in health centers facilitates that significantly. That's all great. Let me talk a little bit about outcomes and where sometimes the health center concept has to be taken a bit carefully as to where it goes. As we are here today, I can predict that several here, but certainly in the hundreds of people within the Moscow Urban Forum, attendees will have high blood pressure or diabetes. Now, the long-term consequence of these illnesses will be heart attacks or kidney failure, and many people will end up requiring renal dialysis or even kidney transplants, if you so wish. Now, on the one hand, one could say a health system is better performing if it provides access to kidney transplants better, more efficiently to more people. And that's, of course, important, and we want to achieve that. On the other hand, you could say for high blood pressure and diabetes, needing a kidney transplant actually is a bad outcome. No matter if it's done well, it's still a bad outcome. But then you can see that the improvements that are required are much more before a hospital, much more in primary care, prevention and early treatment, and that changes the focus where you come into it. In my work, I've seen a global trend to change what's called a model of care. If I could please have the next slide. And many people ask, what is a model of care? And just on the right side, the concept of what healthcare should provide goes from the historical old passive recipient, I'm ill, I come to the doctor, please have help, to patients and the public generally being active participants in their care, particularly in chronic conditions. How often can the doctor see the patient and do how much the patient has to live with diabetes and high blood pressure every day of their life? So they have to actively manage that. It goes from treatment to prevention, an early recognition of complications, from measuring a healthcare system by activity, Oliver, how many patients do you see every day in your clinic, to actually outcomes. The focus of the where care is provided moves from the hospital to the home. From the institutional setup, one talks more about services, and from buildings, one speaks more about what the service virtually looks like. And just as an example, what that is depicted, and I've seen many images from around the world that look similar. Now, this one is from my most recent work in Saudi Arabia. It shows that the patient, the activated person, stands in the middle of the design of a system, surrounded by their family members. Then comes an activated community. Only then comes the first healthcare provider, actually, and that would be, for example, a health center or a private primary care clinic like in England. And you see, as further you go out, then you become to the hospital and specialized centers. And the services are designed along patients' needs. Rather than saying, I'm a neurologist, I plan the service according to the disease, epilepsy and Parkinson's disease or so on, I plan the system as to what the patient needs. Either they have an urgent care, something, I'm ill today, so I need help immediately. It might be in the middle of the night. So that's one need state. Another one would be, as I said, I have diabetes or high blood pressure all the time, so how do I chronically manage that condition better? And so there are 6 types of services. Now, that may be a nice picture, but if you think through it, how you would organize a system that actually follows the needs rather than the organization, you notice that many things work differently. Financing works differently, clinical governance works differently, and how the patient gets through the system and what good outcomes mean starts looking differently. So my plea is to say that health centers and polyclinics should be understood as an advanced and improved primary care to support the patient on these journeys rather than a simplified hospital, if you so will. At this point, I would like to introduce the panel members first of all, and I go just by an order as they sit here. We've got Ms. Oksana Drapkina. She is the director of the National Medical Research Center for Preventive Medicine. Welcome. We've got Sanna Vesikansa from Helsinki. She is the Deputy Mayor of Social Services and Healthcare in Helsinki. Then we've got Anastasia Rakova, who is the Deputy Mayor of Moscow for Social Development, and health is under her remit. We've got Natalya Pochinok. She is the, so make sure I get the title correct, Director of the Russian State Social University. Welcome. We've got Professor Sergey from the University in Seoul, in South Korea. We've got Mr. Andrey Asadov, I get them all the names correct, the CEO of the Asadov Architectural, so welcome, and Mr. Dmitry Petrukhin from DocDoc, one of the digital solutions. May I start a question for Ms. Rakova? This year you've got implementation of the Moscow Standard Plus program. It's the second stage of the development of the medical institutions in Moscow and the improvement of the quality of the services. What's sort of the main thrust, the main direction of transformation for this next phase, and could you tell us how you go about that?
Good afternoon, dear colleagues. May I say a few words about Urban Forum in general? So the Urban Forum is being staged for the 8th time, but actually this is for the second time that we have Urban Health cluster, where we speak about health only. And today we are speaking about the urban questions through the prism of healthcare. Many experts believe that any management decision, wherever area it is taken, should proceed from certain principle, whether it improves the public health or it doesn't affect the public health or deteriorates the public health. This is an innovation because never economic development or the urban development was considered through the prism of how it impacts healthcare. I just think that very soon, actually, all the doctors would remain jobless, unemployed, because all the decisions in any area, such as construction or industry, would proceed from how it affects the healthcare. So this is just a bit of introduction, because we people who deal with healthcare, due to our position, still have to improve and develop healthcare. It's an open secret that healthcare is one of the main criteria in terms of how megacities compete with each other and how they develop. The megacities and big cities, they compete for people, and people would choose and opt for the cities depending on how well the healthcare works. So my healthcare and our parents' healthcare, family members' healthcare forms a foundation of our decision-making. The public healthcare, better lifespan, longevity, actually are things which depend not on the high-tech technologies, but rather regular checkups of patients who have some chronic diseases. And that's why health centers, accessibility of health centers is becoming of paramount importance. We have proceeded with the second stage of the Standard Plus project, aimed at providing accessibility and equal access to health care to all the residents, wherever and in what district they may live. So this is not about some remote places of Russia, such as Khanty-Mansi Autonomous Region, for instance, where a lot would depend on where you live, but even Moscow cannot boast equal access to healthcare. We have 450 buildings which accommodate health centers. They were set up and they adapted for certain standards at a different period of time, and sometimes they didn't follow any standards at all. For quite a while, it was the doctor-in-chief, actually, who would manage the health center. He would be the one to take all the decisions, what equipment to buy, the schedules which were there. So this was the domain where actually the doctors-in-chief would be most knowledgeable. And in one health center, you may see one piece of equipment, and another will see 5 such pieces of equipment. We have to provide for 100% of checkups, outpatient checkups, and therefore we have to rearrange how the health centers work. We came to a conclusion that we have to propose a single standard for all the health centers in Moscow, and we do believe that implementation of that standard would improve the quality and access to healthcare. So these are the 4 directions of our work.
So the first one, this is the schedule. For today, it's quite difficult to explain to a person that in one clinic there is the cardiologist, and in another one there is no cardiologist, and it's difficult to explain to people about this. So earlier we are supposed to have one standard of physicians at the primary level, and I think we now in all outpatient centers will have 8 main specialists, and without the specialists we cannot provide for checkup and examination. Also we have 2-level system of outpatient healthcare systems, and then we'll have also the standard of 5 specialists, 5 experts, and they will be specifically for outpatient centers. These specialists should be present in these centers, and the quantity of the specialists should meet the demand of people in this or that neighborhood. And we know that in each neighborhood more people go to these outpatient centers, and in other neighborhoods less people go to the centers. Like 30% difference can be here, and different number of specialists should exist in this or that outpatient centers. This is our first direction, and we have already 500 more specialists in different centers. Then one standard of equipment, and here we speak about all equipment, starting from simple one and ending up with very difficult narrow equipment. In the beginning I spoke about this, that usually we so chief physician asks for a number of equipment, and then we give this equipment to this or that center. But now we'll have a standard, one standard, and we'll replace old-fashioned old equipment with a new one. And also this equipment should be linked with the schedule. It's very important also who will use this equipment. So next year we'll purchase this equipment, and then we'll use it. Then another direction in providing of equipment. This is replacement of all analog equipment to digital equipment, and this gives us a new opportunity for development. This is a new quality of films. We can save them in an electronic way, and we are not linked to the building where we do examination, but we can also go to other doctors. This digitalized medicine helps us to have all all our examination in different places, and we have one center, and we can have high class specialists in one place, maybe very specialized narrow specialists, and this is our future also. Another direction also very important, this is United Visual Standard and United Comfort Standard. We spoke a lot about these consumers and people now, they want to get medical help, but in comfortable conditions. And we have such a term, that environment also can help you. When a person comes to a center, medical center, and he is not scared of this medical center, he feels comfortable there and he wants to come back. So we'll have one standard, one and the same standard of organization of space, one standard of logistics, one standard of location of different rooms in outpatient centers. So there should be one standard of logistics of all space in all outpatient clinics, outpatient centers. And the most important rooms which have very high demand, all these rooms should be on the first floor. For example, if you want to get your blood analysis, it should be on the first floor, because this is like the most important room, and everything should be very logical in this logistics, in this navigation. Just because nobody thought about this seriously, but people thought that consultation is very important, and that's all. But other things are also important. So now we pay a lot of attention to navigation as well, to layout, to logistics of this space inside of the center, medical center. And all outpatient centers should have one logistics. So you can go anywhere, and so all space should be comfortable and understandable, and the one principle should be the basics. And this medical center should be comfortable also for specialists, not only for patients, because physicians spend very much time at work, and they also should feel happy in this environment, in this working environment. So we just asked physicians about this. In Moscow, we have good technology, which allows us to ask a lot of questions, to do interviews. And we had this research. 4,000 physicians participated in this, and we asked them what furniture they would like to have, how would they like their rest room should look like, their recreational room should look like. And we wanted to create these conditions which they want. And we'll have new standards for this also. And so what is a possibility of the standard? We'll never repair any work only in accordance with this standard. So earlier it was important to paint something and to replace some furniture, and we never had any standards. But now in Moscow we'll have a lot of standard solutions, and everything will be done in accordance with the standard. Another direction which is very crucial for us, this is in information and digitalization, because medicine is one of the sphere which is ready, maximum ready for digitalization. And Moscow healthcare system knows digitalization. We have electronic queue. Also, we developed we developed some electronic cards. Also, we'll have also the same standard for hospitals, not only outpatient centers. So we'll have soon a new level of digitalization of healthcare system. Also, we'll create, one medical card of a patient. So all information will be in this card, and it will be electronic, because this information is the basics for big data, and other smart solutions can be, filed on these basics. We also have digital counter in hospitals. So maybe we want to digitalize paper documents. We'll have this medical card, and this will increase quality of information about patient, and then we'll treat patients better with this electronic information, with this one card, electronic card. Also, we'll have one single database of all injections for kids, vaccines for kids in Moscow, and we'll have all information about vaccination for kids in Moscow. And now we have been conducting quite huge work. We will form a system of clinical support for physicians, and it will allow us to have all standards, protocols for physicians. Now it's like a book on the shelf. A physician should read it. But when there is an appointment, a doctor cannot do this, and he cannot read it. But so this clinical support will be digital, and there will be like some hints for physicians what are probable diagnoses, for example, and then there will be a list of appointments, research, and after the diagnosis, again we'll have a standard which is accepted in the country, and then the treatment will be formed. It will increase the quality of treatment, and it will simplify lives of our physicians. Also, we want to be proactive. Speaking about hospitals and research groups, we want to create a structure which can really accept all people, all patients, but also we have to be proactive. Now, in the country, we don't have this culture of preventive health, because while we don't have any symptoms, we don't go to medical centers. That's why we'll motivate people to do checkups preliminary, like you know that we opened new pavilions of health in 46 parks. So about 40,000 people already went through this exams. These pavilions are also, in the general infrastructure. A person comes here and he gets results, and then he gets a medical card which is available for physicians where in his outpatient center in his neighborhood. And if he has some strong deviations, it can be seen to his physician who is in his neighborhood, in his center. So this, center, medical center in the park is linked to each neighborhood. And our medicine should not be mysterious, should not be secret. Medical card should be open for patients to full volume. On the other hand, we believe that patients also have to add in his medical card with some analysis, research. He can use some additional information there. He can add this himself, maybe when he comes to other doctors. So we'll open medical card for people, and even now we'll have, you can have your test results, analysis to electronic mail, and telemedicine will be also developed. So I'm not a physician, but I think the quality of consultation will be increased, and maybe the second opinion also should be important. These are the main directions. I can speak endlessly about this. Maybe we can continue to discuss this in the process of our discussion.
Thank you very much for those very illuminating comments. Maybe I go to Ms. Vesikansa on her experience with clinics in Helsinki. How have they developed? What are the guiding principles? How you in particular work with networks of clinics, and sort of what are some of the themes that Ms. Rakova just highlighted? How did it look like in Helsinki?
Thank you, and thank you for inviting to this important discussion. I did visit one of your pavilions in one of the parks yesterday, and I was really glad to see that you are taking the health services where people are in the parks to make it easily accessible and really comfortable and easy. And I think that is also guiding principles for us in Helsinki. It has to be easy to access in order to really make a health impact and strengthen the prevention. I will very quickly tell some guiding principles of our development in Helsinki, and hopefully it's a good perspective. Okay, thank you. Hopefully somebody heard something. Now at least it's loud. Hopefully my presentation from Helsinki will also bring a good comparison with Moscow. Let's go further. Somebody turning the slides? Thank you. Here's a picture of our development in Helsinki. We have a concept of health and well-being center. So it's an old health center, but we very much believe in integration of health and social services. We know that majority of people, when they have health issues, it could be only one health specialist they need to doctor or physiotherapy or something they need to visit. But then those who use a lot of services, who are very much in need, they very often need a lot of services and also social services, disability, elderly care, many other services. So we believe in the integration, and we have built our development of services with this multidisciplinary support, working very closely together. Like I said, majority of people are quite healthy, and they also want to live with a healthy life. We just need to support it, and so we have developed many digital services to make that work easy. So, for instance, we have electronic access to discuss with the professionals. We have symptoms you can online for the most common symptoms. You can make a test and also get then guidance what to do, or maybe if you have to go to the health center, very often you actually don't. And then also to have remote care, for instance, in rehabilitation we have tablets, and we're working, the nurse is working through remote access to give guidance. So trying to make this easy, and then of course, like you said, patient records, to have it in one place. This is very much what we are doing. But then, and there in the picture it says increasing clients' resources. So the similar what you are doing, motivating persons to really find their own resources and make, for instance, in chronic diseases, life changes, which is prevention is always. It's more human, and it's also more financially sustainable, and many other things very positive to do that. But then for those who need more services, we are developing services where you have even an own contact person, so one person who will then gather the different services and the needs of the clients around his or her service needs, and then to make it more easily accessible. Loneliness, what was mentioned earlier in the discussion, that is, for instance, something that I think in the urban setting we need to tackle, and very closely related to also many health issues. We can go further. So here's just a picture of shifting the emphasis services. So there is the digital services 24/7 for many. That is the very good solution. That's also what the citizens are expecting from us. They they do it also in banking or travel services. They want us to be as easy and easy to access. But then there is the minority who really need to come to the service itself, so to say, to the building. And we are also having the very same ideas what you are doing. So having the health and well-being centers in the locations which are in the metro connections, next to the shopping malls, where people actually are, to make it easily accessible, and then gather different expertise under one roof, and to make it that way easy. Let's go to the next. What is shifting? Next slide, please. So here are just some theses. I put our core things together, and hopefully it's also useful in the different cities represented here, and for all of those experts who are here. We believe that the integration of the services is the core, and they can work together, and that also brings the best impact that is good for the people, but then also for the system and the taxpayer. Next, please. But it is really hard. You need a lot of trust. We have different expertise coming from different insights, and to make that multidisciplinary team really work, it takes time, but I think it's definitely worth it. We already know from our, for instance, family services, which are the child health services integrated around the maternal and child health clinics that are very strong in Finland, in Helsinki. So there, for instance, we can see that when the experts work very well together, that can also prevent, for instance, child welfare services later on. So very important work to do this multi-professional work. Next slide, please. Digital services can really help in shifting resources that are always scarce. I think in all the cities, the resources there is always the limit. And then we need to really shift those resources also to the people who need the services the most. So elderly who cannot leave the house, they need home care and home hospital coming there many times per day. So we need to have resources for that. For that, we also have to have very good and well-working digital services and those lighter services. And then one more slide, please. And really to make an impact and really make the strengthening prevention to get all the system work, the citizens need to be involved in the very beginning. People have very different ways of life, very different needs. So there we need to really make the service work for them in this very individual life, and there needs to be then also service done together, how to plan from very beginning, and also what you said, how the experts have been also designing the places and the clinics. That is also, of course, very important. Next slide, please. And that is thank you from Helsinki.
Thank you very much. I notice a lot of common themes. May I go to the other side of the world and ask Professor Kim to address us next? You lead the hospital in Seoul from the National University, a network of organizations as well, and I understand that you have a partnership arrangement with Moscow where you collaborate. Could you please explain a bit more about the network and what your joint working consists of?
Thank you for introduction. Добрый день, уважаемые.
Good afternoon, ladies and gentlemen, dear panelists, dear colleagues. I represent Bundang International Medical Center, which is attached to Seoul National University. We cooperate with the healthcare department of Moscow. We have long-standing relations. We have much in common. Many doctors arrived from Moscow healthcare clinics to Seoul in order to share their experience with us, and we also were glad to share our own experience with them, how to manage the hospital there. For technical reasons, I cannot show my presentation, but I would like to very briefly tell you what our hospital is about. How the health center or polyclinic works there. We have the inpatient clinics there, but also the outpatient department, and I'll speak about the role of digital services in healthcare. Our hospital is distinguished by being client-centric, and really the management system works very well. We have logistics, which works very well. We have continuous growth. When we set up the hospital in 2003, within 10 years, actually, it entered the top 5 leading universities of South Korea, and we are providing advanced services. We employ 5,000 people. Actually, out of them, about 800 doctors and 1.7 thousand nurses, 1,300 beds, 6.5 thousand patients attending doctors in our hospital. So the whole polyclinic center actually has 156 doctors' offices. So it means that daily, in the morning and in the evening, out of 156 offices, we actually use about 85% of those rooms. So if we make our math correctly, about 60 to 70 patients are being treated per day in every office. Actually, the healthcare system in Russia and in South Korea are different, because 95% of healthcare in South Korea are provided not by public organizations, and only 5% is being state-owned. We don't have such a system as collecting the database, a unified data system. All the patients' records are stored by every clinic or every hospital on its own. In order to address this problem of disintegration of the data, we decided that we would develop a personal health report, a special application when a patient, when is treated in our hospital, for instance, actually sees doctor in our polyclinics, he will come to the center, would download the application, would get registered on the website of our hospital, and all the analysis, all the samples, all the data actually would be available from his smartphone. When he goes to a different hospital, for instance, he may show the data on his smartphone or his tablet to the doctor. He may show his X-ray data, all the drugs which were administered, dosages, etc. In addition, this application helps us to fully control the schedule for actually attending doctors and seeing doctors, and the schedule of injections for children also is available there. So this is a kind of healthcare manager for our patients. Some statistics. We have 9 tomograph machines. One is mobile, which is being used in the intensive care unit, and actually 87 such actually ICT are being done there. MRI, actually. We have actually 253 MRI shots done every day. PT, actually about 42 PET surveys we do daily. So it means that we do a lot of such investigations. And this is thanks to our system, which actually helps us to distribute resources appropriately. This is what concerns this topic. Our hospital is also known as the first hospital ever which actually avoids films and paper in its work starting from 2003. So we are fully digital. And we remain digital in our subsequent work. So all the processes are digitalized. And it helps us to get very good outcomes, not only in terms of treating people, but in terms of how we manage and how we automate all the processes which are taking place in the hospital. For instance, the system of continuous servicing, when any professor of the hospital who is treating a patient may go to anywhere in the world and may use any gadget using cloud technologies, may get into the data system of the hospital and see what is going on with the patient. So see what treatment has been administered and recommend certain adjustments. We have again set up a lot of clinical protocols. In South Korea, actually, there are now protocols designed by the healthcare ministry. Every hospital would develop its own protocols and would make sure that the process is standardized, is streamlined, in order to provide best quality for that price. So it means that we would like to make all the processes cost-efficient and successful and efficient. The same is true of the use of the drugs, though there is a system which keeps tracks of the medications which are administered by the professor. Then the patient goes to the pharmacy, and all the medications and drugs would be packaged with the barcode on the package. And every patient actually who are treated in the inpatient department would have a bracelet with a chip, and so the information is scanned through the barcode, and therefore we may avoid certain mistakes. For instance, when a wrong medication would be administered or would be delivered to a wrong patient. The same is true of antibiotics and biochemistry drugs. So there is a system assisting the diagnosis when, for instance, a doctor administers certain treatment, and if that patient actually already attended or saw a different doctor, and the previous doctor actually administered the same drug, so the system would advise that actually in that case the dosage would be doubled, and you'd rather for instance use another drug. The same is true of the blood transfusion and other processes. That means that digitalization deeply penetrates into our healthcare system, and it facilitates the work of the medical centers, and it helps us also to prevent certain errors due to the human factor. There are a lot of other things which we may boast, some smart decisions, and as far as I'm running out of time, it would be very difficult to cover all of them. That's why I just thank you so much for your attention. And you may find more information on the internet about our hospital, Bundang Seoul National University Hospital. So search the web and you'll find more information about the hospital. Thank you so much.
Thank you very much. One of the difficulties with sessions like these is that all the participants have such a wealth of experience and expertise to share that we always run out of time. So I may have to ask the other panelists to concentrate on the main points. But may I ask Ms. Drapkina next? You are the director of the National Medical Research Center for Preventive Care. So you've heard a lot about the influence of digital in processes and in healthcare and sharing records and the rest. Could you maybe expand a little bit on how preventive care happens in health centers and how that gets pushed forward?
Thank you so much for your question. really, the preventive part, the preventive component of healthcare is skyrocketing, developing at a rapid pace, and the objectives which were put forward by the President of the Russian Federation could not be performed, could not be attained without building up on prevention. I will try to stick to the time limit allocated to me. Let me remind you that actually the preventive medicine can be split into individual and public one. So prevention is applicable to everyone. It starts before the child is born, it continues when the child is being delivered, and it actually lasts throughout the person's life. For every age, we have well and accurately developed set of preventive measures. This is a very special set of measures which actually have been clinically proven. This is something which can be attributed to screening both at the individual level and at the population level. Let me stick to both those segments. If we speak about the population level, so to say, in the framework of the national projects, and these are the demographic national projects which are addressing the problem of public health, because public health is all about the population prevention. This is what environment in which we live, this is how we communicate to one another, this is the level of responsibility for your own health, which is not so mature in Russia. If we speak about the population healthcare, we have to start with the risk analysis. Which risks are more widespread in Moscow or in other centers? We have certain answers to those questions, and they were made possible because we did 2 epidemiological surveys. Very often we mention them in our research, and people from my center, people involved in the preventive work, they always make reference to the risk analysis involving the Russians. For the first time over the many years, we are working very closely with the healthcare department of Moscow, and we are doing a survey on the epidemiological survey in Moscow in order to identify some risk profiles. In brief, so the men have become more obese. This is a widespread tendency, so they have become more obese 2.5 times compared to the situation 10 years ago. It means that actually blood pressure is more widespread, and when a person is asked what medication he takes, usually so a man would call his wife or his friend. So it means that they are not seeing doctors. So the Russians are smoking less, and the federal law number 15 played a big role there. So passive smoking reduced 58%, but we have to focus on young women, on girls, especially the high school students or the first-year university students, when usually ladies start smoking. We achieved certain success in terms of reducing alcohol abuse. Alcohol-based death rate decreased 17%. This is the first stage of the projects, of the events which are to be based on certain risk factors. Every region, and we covered at least 19 regions, they are all different. And I do think that very soon we'll have very exact and accurate information about Moscow. And let me speak about the individual prevention. So, for instance, we may propose certain motivations, recommending people to do a regular annual checkup. But such a checkup should be of high quality, should be comfortable and convenient, and that we don't lose any single piece of data. Our preventive continuum should end up with the inpatient checkup or examination. And Anastasia, Rakova, spoke in every detail about that. And if we implement one single standard for that, it would be great, because we need standardization. And probably After that, this actually standardization or standardized approach would be decorated with some individual approaches. Decree 123 came into effect since May 2019, where the occupational checkup and annual examination were combined. What Ms. Rakova spoke about, this is a list of certain analysis or checks are what is being included into the examination. This is what is being done by some mobile units done in certain parks. This is something which may help us to say that almost all the people in Russia, in Moscow, did this examination. For instance, if certain checks are missing, we will proactively approach these people who missed certain checks. We will recommend them to see the doctor or to come to the clinics to do what is necessary to be done. Actually, probably everything is ready, everything is prepared, but if person doesn't come to the clinic, we may be still sitting and waiting for the person to come, but we may act proactively or provide more incentives, adding some motivations in order to facilitate the checkup, in order to bring up responsible attitude to people's health. In terms of preventive medicine or healthcare, first and foremost, I would like to say that we have developed certain legal documents.
Also, we have all structures which can do this individual prevention work, and also we have to motivate people and make this issue, but we should do this intersectoral. For example, where can we ride bicycles? Where can we ride bicycles if there are no bicycles? Where can we have some physical exercises if there are no some places for this in the parks, for example. And this should be our priority because people should be really satisfied with this.
Thank you so much. May I ask Ms. Pochinok to address us next? You are the rector of a large university in social studies, so you measure the impact and the changes in social attitudes as well. Could you tell us a little bit about the programs that the city runs to increase health awareness and what impact they have, but also maybe reflect a little bit what is the right balance between government and state doing things and influencing social attitudes versus people being responsible for their own life? Where does nanny state end and where does personal responsibility kick in, and what's your experience?
Конечно, московский.
Yes, Moscow standard, a new standard is something bigger than just, lean medical center, which is now in Moscow. And this is more than the connection between medicine and social sphere. Because here we have already possibilities to go in for sports and some special attitude to bad habits, also special attitude to nutrition, which is a very important aspect for us, especially for young people, and they can improve their health and take care of their health. The unique project, which is called Healthy Moscow, and now we have checkups in parks. People come there with, in big groups. Maybe they come with their colleagues. So these are their first steps of medical examination in the parks. And besides checkups, we have launched another project, Sports Moscow. And there is also an opportunity, for people of different ages to do some kind of physical activities. And this is great because this is a complex approach. If we speak about statistics, people now, so they became more careful about sports. Earlier, only 61% did sports. Now, practically 80% like sports and physical activities, and on a regular basis 3 years ago it was 16%, now 25%, and people who really control over nutrition, 60%, also 40% just think that they have to buy healthy food. Less and less people complain that healthy food is expensive and they don't have money for buying this food. And now it's crucial for us to show intersectoral cooperation and also social works, sports, should be all interconnected. And again, we need to make everything convenient and comfortable concerning health of people. Yes, lanes for bicycles are important, and we should organize all this. Healthy lifestyle and health now are top priority for everybody, and also for people. Digital technologies will change not only medicine, and intersectoral correlation also will change our lives. Everything will be more transparent. Social University in Goncharovsk Park will be also a partner of the sports action, sports campaign. But besides our sports program, we'll offer another program which is very unique, analysis of food behavior of people. There will be consultations, daily consultation of all our citizens, residents who come to us. We'll work with our colleagues from the medical pavilion, because besides food behavior, a person should have a clear picture of his tests, the results of checkups, which he can make in medical pavilion. I would like to support everybody, and I like that these new approaches are developing and the attitude is changing. That's very important. And this experience, which we now have in Moscow, I think should be known in other cities of our country as well.
Thank you very much. We've got two more elements, Mr. Asadov and Petrukhin, in the architectural and the communication digital sphere that Ms. Rakova addressed earlier a little bit. Maybe, Mr. Asadov, could you very briefly, since we're running out of time very fast, give us some views of what the architecture of a good health center from tomorrow should look like?
Добрый день, коллеги.
Good afternoon, colleagues. Yes, for me it's very pleasant that within the urban forum we have this topic of healthy environment, because the space of the city itself should be healthy, and in this case so we will not have so much need in hospitals and physicians will have more time in this case. And the environment itself, the neighborhood, the city itself should fulfill this preventive role. Now I will show you how. So I will show you this healthy space which we have managed to create within our big team. So the government of Moscow also coordinated one project, but for more than 30 years we are developing different functions in each project while looking for solutions, and also we're looking for solutions which can enrich lives of people and create this good atmosphere for people. And now let's look at this image of health. Let's remember the architecture, medical architecture, which usually surrounds us. So this is something monumental, usually, and a little bit dominating, depressing. It seems that if you come here, so no way back. You can't go out of this. But maybe this architecture can look differently, and especially regarding education, so centers for kids. For example, a hematology center for kids. And this was one project of two countries, Russia and Germany. This is a big complex with educational, scientific, medical, and recreational blocks. And in this center, we wanted to create the space which could be motivating for small kids. The main task for us was the following: we wanted to make a hospital which could not look like hospital, but it should be friendly, very nice, happy space. We wanted to create such a complex. There were two big teams of Russian and German specialists, and we wanted to create a very good image, very optimistic. You can see this is the most concentrated part of it. This is like the tree of life. We call it the tree of life. This is a block of different towers of different colors. Here, kids live with parents for several weeks or months, and they have the course of rehabilitation. And some of them cannot even go out, cannot leave the place, cannot go to the yard. That's why we wanted to make the space around them very comfortable. And there are different elements of this complex. A scientific complex conference hall where physicians from the whole world meet and they discuss some issues, how to treat some diseases. Research departments, preventive zones, also even wards, hospital wards should be cozy. We wanted to make them cozy and comfortable. For example, antibacterial curtains. As you can see on the slide, these curtains are in compliance with all standards, but still they create cozy home atmosphere. And also volunteers are here, volunteers from charity foundations. First of all, the foundation Give Life, and these volunteers work here in the center, and they help many kids together with medical procedures. They really help kids to believe in themselves, to believe in life, and to motivate them. And this is one of the central gynecological center in Opalina Street. And we could not leave it like this, so we changed, revamped the facades of the buildings, and also we used here new energy efficient standards. Also, I think now it looks much more motivating, because so this is the place where mothers give birth to their children, and of course to their babies, and of course this should be very good looking. We revamped the whole city. We built a new building, and also in accordance with new technologies. This is quite resilient Soviet architecture, and we just made some small changes. We used different colors, and also changed not so much, but you can see that this space is really changed. And the last project, this is our view into the future. This is the medical space of the future, how we imagine it. And thanks to this project, we formed 5 principles of healthy architecture, which could be in any elements of urban infrastructure. So the Center of Innovation is called Skolkovo Center Innovation, also has international medical cluster, so 50 hectares, 15 hospitals, outpatient centers, and this will be a focus of innovations in medicine, and it will have healthy environment. The first building, which we commissioned 1 year ago under the coordination of the Moscow government, it became like a showroom of the whole cluster. Here we'll have a research, medical, outpatient center, also conference hall, several labs, and this is like the whole cluster but in miniature. And for us it was very important to create a new image of this medical healthcare center. It should not scare off people, but vice versa. It should have a very positive, nice, good atmosphere. So we used here the first principle. Firstly, we created a very nice light image. It seems that it's made of glass. Fully of glass, and it's some kind of contradiction, but also it's very energy efficient facade. And you can see this is that transparent part here, not more than 50%, but the glass windows are very efficient here. And on top of this facade, we have sun screening coating. So we used here energy efficient principle. This is healthy architecture and also healthy building. And the next principle, this is nature, which should also go to the inside of this building. Here we have some elements from nature, trees, green spaces inside, and we created very positive and light atmosphere. A lot of daily light, but here there could not be overheating. But you can see everything is very light, inspiring. And when you come to this complex, maybe people really are worrying about the test of results. Still, you can feel some kind of relaxation already because of this atmosphere. And you can see here also that here we have the principle of multifunctionality. We know that the central atrium even is very multifunctional. You can have here exhibition halls or congress centers, and here you can see also that we have scientific labs and also training labs, and this is a transfer of technology. Here you can see people from different countries, physicians of different countries, and also Russian physicians, and they work here together. And here you can see diagnostics room. Also pay attention please to this antibacterial curtains, some elements from wood. And we did our best to create nice atmosphere and the space which can be really inspiring and can really make you healthier.
Mr. Asadov, I have to say, if you make the building so nice and friendly, I wish I fall ill that I can go to receive care there.
Мы действительно постарались такую.
Yes, we did our best to make this, building. We wanted to increase a number of people who could go to us and make some preventive checkups. So this is like fitness center practically. Hospital, outpatient center can become like, a fitness center, not like a scary hospital,
Mr. Petrukhin, tell us what is DocDoc and how does it interact and feed into all of the elements that we've heard so far in terms of interaction with people, the public and patients, and help them interact with the health center more harmoniously?
Good afternoon, and thank you so much for your kind invitation. DocDoc, this is a commercial project. We help people who contracted certain diseases to recover by means of digital technologies. Last year, in 2018, more than 1 million people used us in order to to see a doctor. And the people who come to us, to DocDoc, so actually these are people aged from 25 to 45. Let me tell you about what future they imagine and what they really want. We actually have built a very good communication by means of digital technologies, and we may understand these people very well. A year ago, I think, I was in Stanford attending a session on the development of startups in digital technologies. Stanford made a big change in terms of, by means of digital technologies, they would actually make healthcare more susceptible to certain changes. This is about disruptive technologies, Uberization. So, and therefore, Stanford invited everyone to shift to startups and change their attitude towards healthcare. I'll try to be as brief as possible, so we have run out of time as far as I understand. What does it mean to live in a modern city? What does it mean for the youth, for the young generation, generation X, Y, Z? So this is about speed and velocity. So the young people, they want to attend as many places as possible, to see as many places of interest as possible, and health is none of their priority. Right now, more people are interested in healthy lifestyle, but actually, healthcare, this is about screening, about checkups and examinations. This is not important for them. They don't have time for that until they actually fall ill. So this is not convenient for them. So for them, this is not convenient. This is not comfortable. They do not see doctors easily. So second thing, what a man is and what a smartphone is about. So we now spend about 3 hours, 15 minutes on the average a day. We order food, we book restaurants, we book taxis, and so we live by means of smartphones. We meet our social needs by means of smartphones too, so we communicate by smartphones. And the young generation, which uses smartphones, they would like to interact and communicate to healthcare by means of smartphones. So they are very smartphone-centric, I would say. And healthcare in the rapidly changing, rapidly evolving city actually really needs to be consumed by means of smartphones. Most of the services have to be provided digitally. And this is also about speed and convenience, and then I will tell you what changes have already taken place and what changes are upcoming. You actually also get enrolled also digitally. So before, actually, a patient would spend about 3 hours in order to find an appropriate doctor, and just now, actually, he spends much less time, and person wants to use one-click approach to get an appointment to a doctor, and that's great that the city is very much ahead of us, and it has become much more convenient as people are used to get an appointment using just one button. Second thing, what people want, they would like to seek a doctor, to understand which doctor to see, by means of some referrals, by means of research engines. They would like to consume that information. So how do you find an expert, a specialist you are confident about? A person who actually would treat your knee, which you have injured. This is very difficult to get a good advice, a good referral. So still at the moment, people have to consult with their acquaintances, with their friends. And again, people want to have the referrals on tip of their fingers, just pushing a button and get 5 or 6 referrals. They don't want to turn to their friends any longer for that. Telemedicine, engaging doctors. We have launched this service last year, and we integrated several stakeholders. Have you ever used telemedicine for yourself? Raise your hand, those who have such an experience. So there are three of us. Actually, I'm a big fan of telemedicine. I'm a father of 3 kids. And my wife is very nervous, and she uses telemedicine very often, and we may address all her anxieties by means of telemedicine. Just give me 2 minutes more, or 3 minutes more. Quite recently, when I was driving my car along with my parents, I actually used telemedicine as a solution to talk to a doctor. I showed that to my parents and my mother, and this is my success actually. Now he's a big fan of telemedicine too. So I spent quite a bit of time to teach her how to call a taxi using applications, mobile applications, and now she uses telemedicine application, and we launched psychological application. We launched healthy lifestyle and fitness coaches applications, and this is actually so much popular that as soon as, for instance, I show how it can be done to anyone, I become an ambassador of telemedicine. And I hope that very soon you will become such ambassadors too. Medications delivery. Unfortunately, we have some regulations, limitations, and I heard that in the United Kingdom, about 25% of all the drugs all the pills are delivered by couriers. Once a person got some drugs administered, not necessarily he has to go to the pharmacy. It can be delivered to his home. I hope that the law would be amended very soon. At the moment, this market is a little bit gray. We made a survey ourselves. This is something people want. This is something they are going to consume. And at the moment, there are some impediments there, but I hope that these impediments are of temporary nature. So, digital medical history. Actually, everyone needs digital e-records, and Google made a digital medical record 5 years ago, and no one uses that because if it is not dynamic, it is not updated every now and then the person would be reluctant to use it. This medical record, actually electronic record, should interact with you, give you recommendations. So it is not only about healthcare, this is about healthy lifestyle, etc., etc. And last but not least, these are medical recommendations based on big data. We did a research quite recently as to why young people are reluctant to do some checkups and examinations, annual examinations. Everyone who wanted, they gave it a try, and they would get volume as thick as that about their health, but they do not know what to do about that. So no one tells them, no one recommends them what to do about that, about those volumes of paper. So a person does this checkup and he gets just big piles of paper, and that's it. Medicine and healthcare should become individualized, tailored, personalized. It has to interact with a person. A person doesn't have to think, just like, for instance, actually, you do maintenance to your car. You don't think about, for instance, replacement of the oil there or lubricants there. You just actually do that proportionate to the mileage. And so, for instance, you do a checkup and then you would get some reminder on your smartphone just to remember you what you have to do.
much, everybody, for your attention and patience. But before we wrap up, I wanted to ask Mrs. Rakova briefly, and literally 1 minute, to see whether from the discussion here you have any new ideas or inspirations for how to drive your program forward and what's the next priority for you.
Thank you so much. After listening to all the panelists, I understand that we're moving in the right direction and will support everyone. So all the services have to be integrated, have to work together. No industry can evolve alone. So all our projects are common and they are complementary, actually. And we are providing social protection to the people who actually are seeing doctors too much often without necessary symptoms. And we said that probably the diagnosis is wrong. And also, actually, we focus on longevity. And Petrukhin, for instance, tells the elderly people not only to take drugs, but also to do some healthy lifestyle exercises. So there is a big trust between the department and the doctors and the patients and the unified multifunctional centers. So this is a one-stop shop approach to get some doctor's appointment. So a lot of people trust that. And so join our healthy lifestyle approach. And the social workers actually now are visiting patients at their homes, and therefore we are promoting healthy lifestyle everywhere. Together with the architects, we are developing the appropriate urbanistic environment, pleasant to live in. Along with the Minister Leksutov, we are promoting the development of public transportation and bicycles as the primarily means of transport, and our legislature is helpful in terms of adopting necessary laws and bylaws. And thank you so much.
Session, and thank you very much for your patience and attention. We ran well over time, but I think you agree with me that it was worth the extra comments. Thank you very much.
Thank you.